Michael, good luck. Biology and medicine videos. You can join the group, post interested things like comments, ask questions, answer questions. Subscribe to watch more videos and more information about medicine. In this video, we are going to look at pharmacology. We're going to look at pharmacology. And under pharmacology, we shall be looking at brief introductory part of it. Introduction. We shall be looking at branches of pharmacology. And under branches here, we might concentrate only in two, that is pharmacokinetics and pharmacodynamics. We will look at drugs. Under drugs, we'll look at a brief introductory part of drugs to know what drugs are. And then we shall also look at naming of drugs. How do we name them? We will also look at the routes of administration. Where do these drugs pass in the body? That's what we're talking of, routes of administration. Then we shall be looking at pharmacokinetics into details. Here we'll only mention them, and then here we shall look at it into details, looking at drug absorptions. We shall look at pharmacokinetics, drug absorption, including factors that affect the absorption of drugs. Which includes the viability, includes the patient's factor, includes the routes of administration, includes and many more information about that. Then we shall also look at the pharmacokinetics, so rather pharmacodynamics. And then from there, probably we shall be looking at the nature of the drugs, the antibiotics, the analgesics, and so forth, and so forth, and so forth, and so forth. Now, starting straight away, pharmacology. Is two Greek words. That is pharmakon, and then logos, which we get the word ology from. Pharmakon and ology means study. Pharmacons means drugs. Then ology means study. When you join the two words, then pharmacology will be defined as the study of drugs. You can define your pharmacology as the study of drugs. If you don't want to define like this, you can define it as the science that deals with the input and output of the drugs. If you don't want to define it in that way again, you can also define as the science that deals with science that deals with the administration, uses and adverse effect of drugs. In this three way, you have defined your term pharmacology, the study of drugs in brief, the science that deals with the input and output of drugs, and then you can talk about the science that deals with the administration, uses, and side effects of drugs. Now, before we move to branches, we have pharmacokinetics and pharmacodynamics. Branches of pharmacology. We have pharmacokinetics, and then pharmacodynamics. Call it PK and PD. But before we look at the pharmacokinetics and the pharmacodynamics in details, we first need to look at drugs. We need to know what a drug is. A drug or drugs are biological substance that is taken in intended to bring change to a diseased person. That's briefly how you can define your drugs. Biological substance that is taken in to bring change to a diseased person. In drugs, we have what they call naming. And when we are naming them, we name them based on the chemical chemical composition. We name them based on trade name, and then we name them based on generic names. Chemical naming based or depends on the chemical composition of the drugs, and then trade naming based on the branding of the drugs. Brand name based on the trade that makes the drugs. Then generic names are based on the effectiveness of the drugs. Hope this will make sense. In the next video, when we are coming back, we shall look at the details about the pharmacokinetics and the drug absorption, drug viability, and so many more. Thank you.